The director of the Region 6 Regional Health Services responds to the protest action taken against the hospital in this report. On Wednesday last, persons gathered in front of the New Amsterdam Hospital in protest of the new system that was implemented at the hospital's accident and emergency unit, which has since resulted in an increase in the wait time for persons seeking medical attention. Several calls were made for the resignation of the hospital's Chief Executive Officer and Regional Director of Health Services. While efforts to contact the hospital's CEO have proved futile, Regional Director of Health Services Mr. Javon Stevens responded to the protest action that was taken by the residents.
It is my observation that the protest was because of the new system we implemented at our accident and emergency, and there were some calls for the director and also CEO to resign. Some placards stated that nothing's been done for health services in the region, etc. First and foremost, I want to say that each citizen has a right to protest or demonstrate how they feel, but I will ensure that we at Health Services continue to strive to ensure that our services keep improving on a daily basis.
After giving his commitment to working on improving the level of service being provided by the healthcare system in the region, the director explained the new chart system that was implemented at the A&E unit.
The first thing you do when you go to the hospital A&E, the triage system. And the triage will determine whether your condition is urgent, non-urgent, or immediate. And based on that, we see our patients. Immediate patients we see first, because those are the emergency patients, and then there's non-urgent and what we call some that is urgent. So that is the area we're looking at our patients. What we find, however, is that some of our non-urgent patients end up waiting for hours because we are just focused on only immediate patients. But to rectify that, we are working presently on separating A&E and outpatient. We identified two possible areas to do so, and we start this morning, preparation for one of those areas. It can take us about a week to 7 to 10 days to have that area properly fixed for our outpatient department. Now at the triage department, there are 2 doctors outside, plus a nurse, also a clerk. So we double the staff on the outside as doing the triage, and also we have 4 to 5 doctors on every shift in the A&E. When we open up the outpatient, we add another 2 doctors. So we have 2 doctors looking at non-urgent patients.
According to the director, with the new chart system, doctors are able to carry out more detailed analysis of patients. These records will then be stored for a minimum of 3 years so as to have reference files should the patient be admitted to the hospital again. Additionally, one of the major concerns that was raised by protesters was the claim that priority is no longer given to school-aged children and elderly persons. In response to this statement, the regional director said,
"School children, elderly, babies, they're always been a priority at the health facility. I think what happened because of the chart system, when you send the charts inside, persons keep looking at was immediate, was urgent, and they pull in the urgent file all the time. So we're separating all of them. We have different boxes, put the different charts there, and we also have a message going in to the doctors from time to time as the need arise. School children remains a priority. I know it's health services, but we are very big on supporting the education system also.
If the system continues to cause frustration among patients visiting the institution, the director has committed to reevaluating the initiative and implementing a system that will work in the best interest of the patients. Sasha Ramsaran reporting for Channel 8 News.